a retained baby tooth, a tooth that never fell out because it didn't have an adult one underneath it. So I see this a lot. There's a big amount of the population that has a retained baby tooth. And there's nothing wrong with that. When teenagers go through orthodontics, for example, and they have a baby tooth with no adult one underneath it, I do my best to help them keep it, keep that as their adult tooth, right? There's nothing wrong with that at all. But sometimes I have patients who get recommended to have their baby tooth removed in order to put an implant in place. And you got to be careful with that because, you don't have to do that if there's nothing wrong with the tooth and it's solid. It's not mobile at all. There's a reason why you have a retained baby tooth there. It's really special and you should keep it. So I have a couple of stories about that. I have a patient who came to me and she's in her 80s and she was referred by another one of my patients, and she had this baby tooth, and she's had the baby tooth obviously her whole life, but she kept developing a cavity on it over the years and it would get repaired and filled. And, these past several years, the dentists have been really bothering her to remove it, to put an implant there instead. And she really didn't want an implant there. It had a cavity again on it. Anyway, she came to me for that and wondered if I could help her. So when I looked at it, I noticed that, yeah, she's right, that baby tooth was very solid. It was not moving. Even though it had a little bit of root left on it, there was no infection. It just had a cavity on it, which it already had filling material as well. So anyway, we went ahead and restored it back, removed the decay, and got a nice new composite in there, reinforced it a little bit and made it stronger. And the result is perfect. She's very happy. She gets to keep her tooth. She's chewing on it without any problems and no pain or discomfort. So, every situation is a little different with baby teeth. And I think it's great if we can keep your baby tooth there. I mean, there's a reason it never got loose, right? Your tooth intended to stay there with you. So there's another one I want to share with you, which is I had a patient come and find me because she has also been told that, she had 4 retained baby teeth, and one of them did end up getting extracted. And after that, she couldn't get an implant there for a variety of reasons. But she's been living with these little flippers that, I don't know, some of you may have had a flipper made. It's a removable little partial that clips into the area. You take it in and out. And she was just tired of that and wondered if there is any alternative to an implant, an alternative to getting that. And of course, she's never been given any other alternative other than an implant. But she had a feeling that there might be one and that she's not aware of it. She did her research and she saw that there might be. So she came to me and lo and behold, we were able to do something in that space, put something in there permanent that did not involve getting an implant. So she was right, when she followed her intuitive information and found me, because the area and the parameters in her mouth allowed for me to do just what she wanted. And it worked out great. And she's really happy and very grateful that, she was able to get an alternative tooth replacement there. So I just wanted to share a couple of those stories with you and let you know that if you have a baby tooth retained and are you getting told that you need to have it extracted? Be careful about that. There are things that we can do to keep your baby tooth there, especially if it's not moving, it's not loose, it's not giving you pain, and there's really no real problem with it. So if you need advice about anything like that, you can link my information in the description box, and I'll be happy to review your individual situation, whatever that is. I'm happy to tell you what I think about your situation, or you can send x-rays or whatever you'd like, or you can make an appointment. My information is down there. You can make an appointment on my website as well.